Just recently, in episode 91 of the podcast, we introduced our listeners to an innovative new solution for an enlarged prostate, or BPH, that does not require heating, cutting, removal of prostate tissue, or leaving a permanent implant behind with the new Optilume BPH procedure. Today, we'll be taking it a step further. We'll be sharing with you a story of a urologist at the forefront of innovative new technologies for treating men with BPH who was approached by his best friend struggling with symptoms from an enlarged prostate. A best friend who is essentially family to him. This is a story you'll want to stick around for to see how it unfolds. So stay tuned. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On the podcast, we'll be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pullman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. I'm excited to be partnering with Laborie today to bring you our featured guest, board-certified urologist Dr. Sijo Parekattil, who is director of Avant Concierge Urology in Winter Garden, Florida, as well as an Associate Professor of Urology at the University of Central Florida. He was an electrical engineer prior to his medical training and thus has interest in surgical techniques incorporating technology, robotics, and microsurgery. He completed his urology residency training at Albany Medical Center and then went on to complete dual fellowship training from the Cleveland Clinic Foundation in Cleveland in laparoscopy, robotic surgery, and microsurgery in male infertility. He is among the elite urologists in the United States who remain at the forefront of new technology, especially when it comes to the management of benign prostate enlargement. Also joining us on the show today is his best friend, Vinit. I'm excited to be walking you through Vinit's prostate journey, including his personal experience with undergoing a new innovative procedure, Optilume BPH. Dr. Parekattil and Vinit, welcome to the Prostate Health Podcast.
Good to be here. Nice to meet you.
Nice to meet you. Yeah, it's great. Thanks for this opportunity.
I understand the two of you are best friends, and I'm curious how the initial conversation was started, particularly as I know many men are usually quite private, especially when it comes to our health.
Right before this recording, I was thinking about the fact that Sijo and I had actually talked back in 2002 to 2003 about a fertility issue and something that I was dealing with. And just because he happened to be in the space, it was somebody that I knew that I could have a conversation about and get additional information. So that kind of set the tone in a way for me having these kinds of conversations. I think as Sijo said before the recording, when we were kids, these are not topics you would ever think you would discuss with a friend, right? And then as time went by, Sijo had a class reunion that I kind of crashed. He is 1 year ahead of me, and down in Florida, he had a bunch of his classmates, and I knew a number of them. So I decided to go down and hang out with them. While we were there that week, I had been talking to him about BPH that my father was going through. And my father is going to be 88 this year. So I can get into that some more, but he had been dealing with it for a number of years. But then I began to talk about some of the symptoms that I myself was seeing. And I wasn't really sure, was I imagining it, or was this really something that it was similar to what my dad was experiencing? And so, we talked about it, and Sijo said it's something to think about. You should look into it. Maybe come here and we can look at you and see what's going on. And really, that's how the conversation started. I was down in Florida for personal reasons, but we ended up talking about BPH, and it just went from there.
I think, like most guys, it's a subject that we don't really like to talk about, right? Or you don't really think about it. You kind of ascribe it to aging, or things are just changing. And so these are tough topics to kind of bring up. But I think, like with most of us, when someone close to us goes through some issues, it starts to get you thinking, right? It's funny when I have family members who have a certain condition or disease, you always start to wonder, well, do I have symptoms like that? Or like, is something like that going on with me? And so I think that's kind of what happened when Vinit's dad was going through these issues. I think Vinit was great enough to kind of start talking about some of the issues that were going on. And we've known each other since we were babies. And so it's so different when you're starting to think about treatments for yourself. And so it was all of a sudden I was kind of confronted with, if I had these kind of symptoms, what would I do for myself? And how do you address this? As physicians, we get so programmed into projecting on other people and kind of following this algorithm. And then it's a little bit kind of disconcerting sometimes when all of a sudden it's you. And then you're really like, well, what would I do if this was me? And so that's really what started the conversation in terms of some of the less invasive, minimally invasive kind of treatment options for enlarged prostate.
And Vinit, I think that would be helpful for our listeners if you felt comfortable sharing maybe a little bit more detail about what you'd experienced or what you'd seen with your father, but also maybe what were some of those symptoms or that you were starting to experience that were really starting to affect your quality of life.
Yeah. No, my father had symptoms of BPH has had symptoms for probably the last 20 something years. And initially it was treated with tablets, with medication, and that seemed to work in the beginning. And then it got to a point where he had some side effects from taking the medicine. He had to stop some of them. So it was this constant kind of going back to the doctor all the time. And at the end of it, he ended up doing TERP this year, but he also did Urolift last year. So he's had not only medication, but has had to go through 2 different procedures. And having seen what he's going through, I knew that I didn't want to wait. If I did have this condition, I didn't want to wait until I was that age to have to deal with this. What really motivated me was I work in sales and I travel a lot. I travel for pleasure as well. And I began to realize that when I travel, I had to go to the bathroom a lot. I would be in an airport, I would go through security, I'd go straight to the bathroom. But I never felt like my bladder was completely empty. So I'd go sit down waiting for my flight, and then the flight's about aboard, gotta go to the bathroom again. And then I started to notice, sort of dribbling, and maybe I couldn't control it, which when you're traveling impacts you because you have to deal with all those things in front of other people. You might have to go to a meeting. And I think one of the things that complicated was that I drink a lot of coffee. So this is the size of coffee cup I normally use. And so I'll drink maybe 3 of these in a day. And so in my mind, I kind of thought, well, this isn't really a problem. It's just that I'm drinking too much coffee. And I think Sijo and I talked about that. And he was saying, I think your mind is just making an excuse for it. You just think it's that, but it's not that.
Yeah, it's like he should be able to drink however much coffee he wants to. So
Yeah. So those are the main symptoms. And over the last couple of years, when I really started talking to Sijo, I noticed it getting worse. Again, it impacted my quality of life in terms of my work. I work from home, so going to the bathroom all the time isn't a big deal. But definitely when I travel, it was really affecting me.
Vinit, you decide to then move forward with the evaluation and travel down to Florida to see your good friend to start going through the further investigation and sort out the situation and see what is going on. Dr. Parekattil, could you share with our listeners what test you performed in order to really get more information and better counsel your good friend?
Absolutely. So the 2, main testing we did was cystoscopy, where we take a look with a little video scope through the urethra into the bladder. And you should have seen Vinit's face when I first mentioned this. And so,
to be fair, I watched a procedure online. I probably shouldn't have watched it.
And so everybody has trepidation when they hear about that, but we can do it with sedation, with nitrous gas. So nowadays, we're really humanistic and really kind of customize it based on the patient. I think we did yours under sedation, right?
Right,
I believe, yeah. So it's just, we were looking at maximal comfort, and I'm the biggest baby, and I think I project on a lot of people. And so if I feel like anybody's got any hesitation, we're very blessed to have the opportunity to do that in our office, where we can do IV sedation, we can do nitrous, especially for younger patients. It's your first experience, first date with a urologist. You want this to go as smoothly and crisply as possible. And I always hear stories of patients who've seen a urologist and had a really traumatic experience, and then it kind of really dissuades them from seeking care for many years. And it's really sad, right? Because it becomes an artificial barrier where something pretty straightforward and diagnostic becomes this huge kind of mental barrier to getting care. And I've always been very sensitive to that, to really try to make sure the whole experience is very comfortable. So we did the cystoscopy, and he definitely had some obstruction of his prostate, but he didn't have a very a median lobe or anything, but just a bit of a tight bladder neck. And so definitely a great candidate for like a minimally invasive treatment option. And then we did an ultrasound sizing of the prostate. At that time, I think we used the Euroflow, right? The home Euroflow for you, the app. So
the app, yeah.
Yeah, so we're using a Euroflow app that you can, because he was coming remote, that just listens to the audio quality of the voiding and figures out your flow rate and voided volume and stuff. So the three main components, the flow parameters, seeing how well or poorly a person pees, cystoscopy, the video exam of the prostate, and then finally like an ultrasound sizing to get a size estimate of the prostate. Once we had these three pieces of data, we could really kind of start to see the picture where we could tell that he was having poor flow due to obstruction from the prostate. He didn't have a huge prostate, but it was tight on the inside. So I always use the analogy of a donut. Even though the overall size of the donut may be within the normal range, the inner opening of the donut might be tight, and that's what was going on in this situation. So that was causing some obstruction to his flow.
Vinit, I know a lot of our listeners may be in your same situation or have a loved one going through the same situation. In your own words, could you describe your experience with those initial set of tests in terms of your experience with it?
I think at the time, it was a big deal to fly and spend a couple of nights in a hotel just to see a doctor, right, for a physician's visit. And I think I was probably thinking, is this overkill? Should I really be doing all this? And really, just because I knew Sijo so well, I felt like who better to do it, right? If I'm going to do it, I'm going to do it with Sijo. So we went down, my wife came with me, and the actual office visit was great. Like that part was great. I think we talk about embarrassment. I've never had to do this kind of treatments before. And so one-on-one with Sijo, it's fine because we know each other. But going into a physician's office, talking to the nurses, talking to the staff that are there, it took some getting used to.
I remember especially when they were telling him to lower his pads. He was like, what, here right now? So I know it was rough because nothing prepares you, right? It's very humiliating and kind of demeaning to go in an office and all of a sudden somebody's like, well, drop your pants. Let's examine this here. And it's hard. And it was interesting. I was talking to Vinit after, because I'd ask him every day, like, how did the visit go? How was this? What'd you think? And I remember it's such a common thing for us to just go through, because we're going through patient after patient. And he was really nice because he would tell me things about the visit that then, I'd try to give feedback to our medical assistant, just say, hey, look, some of these guys, this is the first time that they're being examined. So you got to be gentle, kind of warm up to them, give them a heads up. Hey, I'm going to close the curtain and then we're going to have you drop your pants. Sometimes a little forewarning really helps. And so these are things that sometimes we really take for granted. And it was really great having Vinit as a patient because he was giving me a lot of real-time feedback. Like, dude, this is the first time I'm sitting in an office. I'm like,
yeah,
how can you just tell me to pull my pants down? So it was kind of interesting in that it really made me think twice about how I approach patients and also training for our staff, like just to be really extra gentle. And, this is scary business and it's not comfortable and it's not fun, and so we got a lot of great feedback from Vinit.
No, yeah, I think with guys, it's a little bit different. We're not used to having to do that. I think I learned a lot from my wife going through childbirth and going through other kinds of treatments where you get used to doctors working on you and staff being around you. You lose some of your privacy, right? Just because of the nature of what it is. And for men, I think we don't really have to ever go through that unless it's a problem like this.
Well, next I was going to see if you could just briefly walk us through that discussion regarding treatment options based on what was found during initial testing and really how you ended up deciding on a treatment option.
So for Vinit, I really, I kind of was like putting myself in his shoes, and he's young, he's healthy. We really want something that won't affect his erections, won't affect his ejaculate volume much, and just kind of trying to keep him as whole as possible. What could we do that where you don't need to take medications, but at the same time has minimal side effects? And we know that his prostate isn't the biggest, it's just tight. So what are some of the options? So we went through a few of the different options. We were thinking about prostatic stents, things like that. But then, unfortunately, because of the size of his prostate wasn't the optimal size for that. So after the initial visit, it was a little disappointing because the other options were a little more invasive. And I could tell just from talking to Vinit, so he wasn't ready for anything like that. And so he'd been traumatized a little bit with the TURP procedure and everything that his dad went through. I could tell I had to be really gentle here, and what could we do to offer him that kind of experience? After that visit, we actually kind of put things on hold. We were like, okay, let's think about this. Because if he had a huge prostate, a big median lobe, I knew in my mind I was going a little more invasive when we have lots of options for that. But this wasn't the case. His symptoms were actually seemed more based on what I, could physically see. So I knew that I need something very gentle, like a truly minimally invasive BPH treatment or, large prostate treatment. And so right at that moment, I wasn't doing anything like that. So we were like, well, let's think about this. And he wanted something quick that wouldn't affect his quality of life. And he travels a lot and didn't want to take a lot of time off. At that moment, I didn't have anything in my hand to offer him. So we basically left it at, hey, look, why don't we take a break and think about this? And then we'll revisit this in a few months. And there's a lot of new technologies coming about. And that's what happened.
We definitely paused for a little while because one of the things is to do something more invasive and having to fly to Florida and stay in a hotel and sort of travel just to do the procedure. If I did something that was more invasive, it would mean spending more time away from home. And there's always the risk when you travel, something can happen. So at top of mind, I think when I talked to Sijo, and we're going to get to Optilume, but at the back of our minds, doing something that wasn't so invasive was definitely top of mind.
So how much time passed? I mean, you guys put things on hold and then...
I think it was almost was it like 6 months, a year?
Yeah, it was 6 months. Yeah, I think we did the evaluation in October, and then probably around April-ish, we started talking again, yeah.
And that's when I heard about Optilume. And it was funny because I watched the videos and the presentation, and I was thinking about Vinit's prostate. So when I was looking at the videos, and I was like, wow, this is if there's a procedure made for Vinit, this is it, and it was kind of cool because I knew exactly his anatomy and everything. And as I was watching the videos and how the balloon works and dilates the prostate, in my mind, I'm just picturing this, and I was very curious. I was like, what size do they make these balloons in? And as soon as they were telling me all these parameters, I was like, wow, this is if there's something made for him, this is it. And at that time, I'd started getting some experience using it for strictures, urethral strictures. I really loved the technology. And so when I heard about the BPH option, he was really right there at the top of the list. As we were exploring utilizing this and reimbursement with the Optilume, I got a few initial cases that I could do with very little red tape. So I knew that he would be one of my first few and wanted to kind of sneak him into that group of patients and it ended up being that he was my very first patient. And so I remember asking me how many of these have you done? It's well, I've done a few. We've done some stricture stuff and all. And I had actually booked some BPH cases ahead of him, but for one reason or the other, those guys bailed or something happened, and he ended up being my very first Optilume case.
Dr. Parekattil, you had mentioned thinking about your friend and his prostate would be perfect for this new technology, Optilume BPH. Maybe to back it up a little bit for our listeners, maybe that haven't catched our previous episode on Optilume BPH, exactly what is Optilume BPH and how does it work?
So Optilume BPH is a very unique type of treatment for BPH where it's a quick outpatient procedure. I mean, hopefully in the future we can do this in the office as well, and we actually have been doing it now in the office. But basically, essentially what's involved is under a little bit of sedation, we can place a special balloon into the urethra and essentially dilate the inner opening of the prostate. And it opens it up to a certain caliber where you get a single cut in the 12 o'clock position of the prostate. So literally like a little fissure in the prostate. And so what's nice about this is it doesn't really mess up the ejaculatory ducts or anything anteriorly or the apex or anything critical, and really makes a nice little cut 12 o'clock position right where the prostate is tightest, which is where the blockage is. And especially if a patient has a tight bladder neck or an area or a mid-prostate area, this is really amenable to this balloon because it really creates a nice opening there. We then deflate this balloon after a few minutes and put a second balloon in that has a special medication called paclitaxel. And I call this the magic sauce because we've had balloons in the past to dilate prostates and just haven't had very durable outcomes. And I think the paclitaxel plays a huge role here. Paclitaxel is an old chemotherapy drug that's been used in cardiac angioplasty so that when you do a balloon dilation in a heart vessel, they then use that balloons coated with paclitaxel so it prevents that blood vessel from scarring down. And so I think that's where the idea sprung aboard that, well, maybe we could use it in the prostate. And what the studies have shown is that, it does play a tremendous role in keeping that fissure open and allowing for long-term outcomes at 4 years come with the Optilume balloon. So that's where it's nice because it's a minimally invasive treatment option for BPH. Only takes a few minutes. And what's nice is that patients usually have an immediate response, meaning that they notice an improvement, a significant improvement in their flow. We'll hear from Vinit shortly, but it's quite impressive. I mean, the effect when it does work well is phenomenal. I think the key thing, like every treatment, is patient selection and knowing what's the best kind of prostate for this. I think Optilume's probably not optimally suited for really huge prostates or a very large median lobe. That might not be the best case for this, but in Vinit's case, this is a phenomenal treatment option for that. And so very minimal bleeding, and we can remove the Foley catheter after a few days. I think in Vinit's case, we just kept it over the weekend and took it out on Monday. We did his case on Friday and took it out on Monday. Obviously, I'll kind of stop there. I'll let Vinit kind of tell in his own perspective what he thought about the outcomes. But I feel like it's an amazing technology.
So Dr. Parekattil, as you mentioned, at this point in the treatment of your good friend Vinit, you were still early on in adopting the technology in your practice, and not by design, but actually with it being the first day of performing the procedure and your best friend just happens to be your first patient. I think that makes the narrative even much more impressive. Talk about increased pressure. Here you are implementing a new technology on the first day of procedures, not to mention, very first BPH, Optilume BPH case, but performing on your best friend. I think that really says a lot about the trust you have in the technology, the data which led to the device's approval, but also for Vinit, the trust you have in your good friend to help you out.
It's just the science behind it just really seemed to make sense. I was an engineer before I went to medicine, so unfortunately I always think very linearly, and it's weird, but I could remember Vinit's prostate, and as I was seeing the videos and stuff, I'm just like, man, this would just fit right there. It's so weird to say, but I kind of visualize where I'd put the balloon, where it would sit. Since we had all the measurements, we knew the length of his prostate and everything, it just made perfect sense. It's weird. It's one of those moments where you really, you feel in your gut that this is definitely the right kind of procedure for the right patient. And it just was a really strong gut feeling that he would do really well with this. But you're right. It's a huge leap of faith.
So Vinit, could you share with our listeners your experience the day of the procedure, along with some of the recovery you had the following weeks after the procedure?
Before the procedure, I definitely was looking forward to it. Sijo and I had talked quite a bit about it. And Sijo and I both electrical engineers by training. We both did our first degree in electrical engineering. So I knew he was a smart guy. And I had a similar engineering mindset. That's the way I saw it, which was, I have a problem. I need to fix it. This is the way you fix it. So in my mind, it made sense to me that we should go ahead and proceed. I know we had talked about different options, but now that we had something in front of us and I trusted his judgment, he's a smart guy, right? We've known each other for a long time. I had complete faith that what he was recommending is what we should do. I think we spent probably half an hour on the phone. I remember one day we kind of mentioned some other things and he told me that those are a little bit more invasive and he didn't think it was a good idea. But he presented the options and Optilume seemed to be the one that would be the best fit for me. I've always been very accident prone. And so I've had numerous surgeries. In fact, I'm recovering from, I tore my rotator cuff. I'm just still recovering from a surgery 2 months ago. The thought of being in an operating theater was not something that made me nervous. I've been there enough times. But those are all kind of orthopedic type surgeries. The thing that probably made me nervous was this was a new kind of surgery that I've never experienced. I didn't know what to expect after the surgery. I knew that I'd be out for the surgery. I didn't have to worry about that part.
These are the jewels.
Yeah, that's right. So you care about them more than an arm or a leg, right? So that was the part that probably made me nervous. Again, there was always this running thought of, am I going too far? Should I really do this? Should I stop with medication? But I didn't want to take medication every day like my father did. I'm in good health. I don't take any medication, as a matter of fact. So I wanted to keep it that way. It just made the case for going through this procedure all the more sure. So yeah, and then the procedure itself was great. The staff, everybody there was awesome. Made me feel very comfortable, came and talked to me. Sijo, of course, was there explaining the procedure. I think after the procedure, the thing that I didn't know what to think of was the catheter. I've never had a catheter before. That was pretty uncomfortable. I had it over the weekend, and I really didn't know how to deal with that. That was a bit rough. And so then we went back on Monday. We did the procedure on a Friday, went back on Monday. And once the catheter was out, it felt great to get that thing out of me, right? It was awesome. And so I actually had a flight to catch that day. So after leaving the office, we kind of got lunch, went to the airport, and I couldn't really tell. I was really looking forward to seeing what the difference would be. And that day itself, I really couldn't tell, just because I hadn't drunk a lot. And I know I was trying to stay hydrated, but I really didn't feel the need to go to the bathroom like I normally would. But it was the next day I knew and I could tell that something was different. And I think the biggest thing that I noticed was the amount of flow, or the rate of flow, was so much greater. That was really the first thing I remember feeling, wow, this really does feel different. And I was like actually getting excited because I was waiting to find out, like, is this going to work? What's going to happen? And so really that was the first thing I noticed, is that when I went to the bathroom, the flow was just completely different. Something that I hadn't probably felt in a long, long time.
Since we both grew up in Zambia, we always used Victoria Falls as a reference point. So in the winter months, that was the flow, not the summer, but
Yeah.
Yeah, I remember, and I think, Abby, his wife, had mentioned that even on the ride back from the airport, right, usually they would stop halfway through to go to the bathroom, and he forgot to do that. So on the way back, it's just amazing that a difference from his trip to the airport and his trip back from the airport. So that's just impressive. I mean, how do you put a value on that? It really is priceless. And that's where, as guys, we take a lot of things for granted. But man, it is so good to pee well. But it gets understated. And I think a lot of us kind of just accept it as aging, but there's really no reason to have to do that.
That's right. I called you from the airport and we were talking about that, because normally I would have gone to the bathroom a number of times, and there definitely was a difference. I think for people listening to this, I think when something happens gradually over time, you don't really notice it as much. Once the problem has been fixed and you're back to normal, then you realize how different, and you realize what you were missing out on, right? And so to me, I think to the average person, if you just talk about you can pee, the flow is twice as better, or 3 times as better, people don't understand that until you go through it. And once the problem has been fixed, you realize, wow, this is how it is supposed to work. And I hadn't been working this way for the last number of years.
One of my favorite things to tell patients is that, obviously it's a goal, it's a dream, it's a wish, but I always tell them, look, our goal is to get you peeing like you're 15 or 16 again. Because we forget, right? Who remembers how you peed when you're 15 or 16? It's hard. But once you get the surgery and the flow gets better, then you're like, oh yeah, this is like, I am peeing like when I used to pee when I was younger. And that's why it's kind of like a moving target. So what do you compare it to? And that's what I think makes seeking BPH or enlarged prostate treatment so difficult, is that it's such a gradual kind of onset. How do you compare that to a fixed point in the past? So I think that's why it's understandable why so many men don't seek treatment, right? Because this is such a unique situation. Like, his dad had an issue, we talked about it, and I happen to be a urologist, and we're both engineers and very linear, and so we kind of gravitate towards that idea very quickly, but that doesn't happen very often. So, but it should, right? I wish more guys out there would seek care, because I think we could help them.
Well, certainly a very impactful story, and one in which I know will help out many men and their loved ones dealing with BPH or an enlarged prostate. And so I'd like to give you both the opportunity in closing if you have any final thoughts today for our listeners.
I can start. I'll tell you a little story. I was in Raleigh, North Carolina about 4 weeks ago, and we were sitting there in a conference room drinking coffee, as we do, and I was drinking my normal share of coffee. Multiple people left to take bio breaks. I stayed in that conference room until lunchtime. I did not leave one time. To me, that was amazing because normally I would be the one running back and forth to the bathroom, right? And even today, when I still feel the difference, I know that something is different. And that's just a great feeling. Definitely from a quality of life perspective, when I travel, I'm not having to go to the bathroom. My dad had gotten to a point where he had to rush to the restroom on a flight that was landing. In the middle of landing, he had to get up from his seat and go to the bathroom. And I never want to get to that point. So I definitely had a lot of motivation to solve the problem. And Optilume has really done a great job in doing that for me with a very minimally invasive procedure. And I'll add one last thing, because this whole discussion and what I went through has even impacted my wife, because these discussions about BPH, my wife had her own bladder issues and she had dealt with it over maybe a decade or more, hadn't gone to see a urologist to discuss it. And as a result of me going through this and fixing it, she's now talking to a urologist and doing some evaluation. So I think it's been great all around.
Just wanted to thank Vinit for trusting me, and he's helped me out so many times in my lifetime. We've got so many stories, and so I feel like I owe him so much, and for him to take that leap of faith with me and really trust me to help him out is huge. And so I want to really thank him for giving me the opportunity. And it's just great how sometimes things work in life, and very grateful to Optilume technology as well too, because I think it really is some amazing technology and really has a place in our kind of armamentarium of different options for enlarged prostate treatment.
Yeah, we still joke about the fact that when we were growing up, we never in a million years would have thought that we'd be having this type of conversation.
Sometimes we'll be like deep in conversation, like, wait, dude, what are we talking about here? Thank you, Dr. Pullman. Thank you so much for this opportunity. This means a lot to us too.
Yeah, thank you very much.
Well, we really appreciate you both taking time out of your busy schedule to chat with us today on the Prostate Health Podcast. You've definitely delivered significant value to our listeners today. Thank you again.
Awesome. All right.
Thanks.
Take care, guys. Thank you.
Thank you.
Thank you again for listening to the Prostate Health Podcast. For those of you wanting to dive in even deeper, make sure to check out the Prostate Health Academy, which offers comprehensive and easy to navigate lessons that I have prepared for you. There's also an active private community forum, and I am there every day providing support, insight, and answering questions. To learn more, just go to www.prostatehealthacademy.com and click on Join Now. Well, that's it for today. We will see you at the next episode.